I forget to hit the recording button. This series is sponsored by the Society for the History of Medicine and the Health Professions, which is the support organization for the UAMS Historical Research Center. The Society supports the Historical Research Center in a number of ways, not only in the form of programming like these stay-at-home lectures, but also in the form of financial support and purchasing books and artifacts for our collection. Now, the Historical Research Center, we're located in the UAMS library, and we are an archives. We are the only archives actually in the States that is dedicated to the preservation of the medical and other health sciences professions in Arkansas. So we're unique in that way. As I mentioned, we're located in the UAMS library. We're in the Ed 2 building on campus, if you're familiar with the UAMS campus. And I'd like to invite you all to come down and see the Historical Research Center. I'd love to give you a tour of the facility. The campus is beginning to open back up again. So if you'd like to see some of the artifacts that we have in our collection, please give me a holler. My email will be at the end of the presentation, but you can see the Historical Research Center generic email on your screen right now. So, and then there's the number to get in touch with us at the center. So please feel free to get in touch with us if you'd like to do so. Going back to the society, I'd like to encourage you, if you're not already a member, to consider joining the society. The dues are inexpensive, $15 for an individual membership, $25 for a family membership, and then it graduates up to higher levels. Student memberships are $5. And you do not have to be a member or a student, excuse me, of UAMS. It could be any student in UAMS. And I'd like to recognize Betty Harp, who is on here, and she just sent me a question, and you may certainly record this. This is actually being recorded also, and as soon as after this is over, after the presentation is over with, I'll do a little editing and add sort of in some title slides and everything. And this presentation, along with the other stay-at-home lectures, will be uploaded to the Society's YouTube channel. And if you go to the YouTube site, just type in SHMHP, or you can either put Society for the History of Medicine, and it will come up and you'll see the previous lectures that we've done in this series. Before I move away from this slide, I do want to go back to the society about the dues, because I keep forgetting to mention. You can either go to the URL that's on your screen. It's kind of a long URL, but you can also bypass that and just go to paypal.me/SHMHP, and you can just pay your dues there. And if you are a member, you should be receiving a renewal notice in the mail, if you haven't already. So hope you'll consider joining us, and if you are a member, hope you'll rejoin or renew your membership. So tonight, before we get to tonight's lecture, I do want to remind you that this stay-at-home lecture happens every Thursday, first Thursday of every month, from 7 to 8. And the Zoom link that you use tonight is the same one that you use that's used for every stay-at-home lecture in the series. So you can just keep that link handy, and it will be valid for all future stay-at-home lectures. Next month on May 5th, we'll have Dr. Bill Gurley, who used to be here at UAMS. He's now at Ole Miss. He was at the College of Pharmacy here, and he'll be talking about a Civil War doctor, Dr. Henry Dye, who kept a diary of some of his surgeries that he performed during the Red River campaign in southern Arkansas and when he was stationed at Camden. Really interesting topic, lots of good illustrations, and Bill is always such a great speaker. So I know you'll enjoy that, and I want to encourage you to come back next month to hear Bill Gurley talk about Dr. Henry Dye and the Civil War illustrations and surgeries that he performed. So finally tonight, we're going to be talking about Mary Emma Smith, a nurse. She was a pioneer Arkansas nurse in the early 1900s of Arkansas, and she truly saw the growth of public health initiatives in Arkansas. And I want to call out tonight and recognize tonight Betty Harp and Elizabeth Hill and Teresa Clark. Those are the three I saw sign on, and they're members of the Daughters of the American Revolution, the Prudence Hall chapter in North Little Rock. And Mary Emma Smith was a founding regent of that chapter, and so I want to thank Teresa and Elizabeth and Betty for all their work all the information they have gathered on Mary Emma Smith, because it really helped me a lot to pull this presentation together. So thank you all, and thank you all for being here tonight. So Mary Emma Smith, she's an interesting woman, and she was born in Claiborne County, Mississippi in 1891. And I've noted Claiborne County in red on the map on your screen, and also has the #1 number attached to it. And I've shaded the other counties on that map because she was born in Claiborne County in 1891, as I mentioned, but her family moved around a lot in the Delta counties. #2, Jefferson County, and then 3, they went to Natchez for a little bit in Adams County, but they sort of moved back and forth through those 3 counties. But Mary Emma Smith, as I mentioned, she was born in Claiborne County, Mississippi in 1910. She graduated from high school in Fayette, Mississippi, which is in Jefferson County. And then later the family moved to Natchez, and then they moved back into Jefferson County. So as I mentioned, they just sort of moved off and on through those 3 counties. Now in Mary Emma Smith, in the 19-teens, she went up to Natchez, or went down to Natchez actually, to Natchez Hospital, where there was a training program for nurses. And in 1914, she finished that training school. And I want to read a little bit from her. She did an oral history in the 1970s as part of the Arkansas State Nurses Association oral history project. And it's really, she was very descriptive in her her memories. And it's so interesting that I want to read just a little bit about some of her work in Natchez. Let's see if I can find it. Of course, I'm not going to be able to find it when I when I want it. But the hospital itself, she was kind of disappointed. I would say she went there sort of expecting a formal education, and it really wasn't that. The doctors, it wasn't a school as we think of a school. It didn't have organized classes. It was mainly practice. So when she left that, she finished her training, as I mentioned, in 1914, but she didn't, in her memory, she did not think fondly or remember fondly her time at the Natchez Hospital. She felt more of a time when she could have learned more at the Natchez Hospital than she actually did. But nevertheless, she did get some training at the Natchez Hospital, which sort of set her on the path for her nursing career. Now, nursing was not her first choice for a career. Originally, she had thought about being a teacher. Teachers were the education profession ran in her family, and it was assumed at some point that she would just become a teacher herself. But she really had other plans. She really wanted to go into the nursing field, and we're glad that she did because she made such a huge impact, significant influence on the field of nursing in Arkansas. So after she leaves Natchez and gets her degree or certification from, or training, I should say, from the Natchez Hospital, she goes home for a bit, and then she goes to Shreveport in the late 1900s or late 19-teens to work sort of as a private nurse down in the Shreveport area. And it was in the Shreveport area during when the U.S. entered World War I, and she decided, she saw an advertisement calling for the need for nurses in the Red Cross. And so while she was in Shreveport, she actually wrote to the Red Cross and volunteered her services as a nurse for the Red Cross. She did not get a reply. And so she felt this strong need, though, to be a nurse for the Red Cross and nurse the soldiers. And she even says in her oral history, she says, talking about a newspaper, a headline, she says, "Nurses needed, soldiers dying. Every nurse should respond." And so this is while she is in Shreveport, and she says, "So I was on duty with him, the doctor, and I'd been teaching his wife and his 3 daughters, how to take care of him. And so I called the doctor to tell him that I was going to leave, that I was going to nurse the soldiers. So I went home that night where I lived. I was so enthusiastic about it. 2 more nurses became interested in going. They said they'd go with me. So we got ready and we went, and I took a big trunk with me." So they decided they were going to leave. They packed up their stuff and they headed to Camp Beauregard outside of Alexandria, Louisiana, which is not that close to Shreveport. It's not that far either, but it's not that close. So they get on the train and they head to Camp Beauregard in Louisiana. Camp Beauregard, a lot of the soldiers, it was a training site. So you had soldiers from Louisiana and Arkansas and Mississippi coming into Camp Beauregard. But Camp Beauregard was actually became sort of a focus or the center of one of the spread of the Spanish flu, which started in 1918 and went through all of 1918 into 1919, early into 1920. And so they get to Camp Beauregard expecting, to take care of these soldiers. And instead, it turns out to be sort of a hotbed of the Spanish flu. But they get to Camp Beauregard, and remember that they just got on the train. They had not heard anything back from the Red Cross. So these 3 nurses got on the train and headed to Pineville, Louisiana to go to Camp Beauregard. So, so this is what she says in her oral history. "Not only did I go, I took 2 women with me. We were all about the same age, but they were lovely nurses. One was a blonde and one was a brunette, and they were just lovely. We went on a train that night. I had a great big trunk, so big. And so I took my trunk and I took a little handbag. I did take my bag with a uniform, my shoes, the things that I would need to start work. Now, I'd been on duty that day, and then this night we got on the train. The next morning, we got to a little siding place close to Alexandria. We all got off. There were many people, and they had papers to give them. We were the last ones." And then she goes on, "And this man came over and wanted to see our travel orders. I had never heard of travel orders. I told him I had none, and he said I couldn't go. He said, 'Well, you can't go out there,' and said, 'You've got to go back.' And I said, 'No, I've come to nurse the soldiers. You see, I'd come and they said they came. You see, I'd come and I said they came with me, but I was the spokesperson.' Well, that went on in this argument back and forth. Well, he called in some of the soldiers and they told us we couldn't go. We had to get back on the train. And I was telling them I couldn't. I just couldn't do it. I'd come to nurse the soldiers and they needed me. So they finally loaded us in an old car of some sort. And I can remember the light shining on that gun because the car had running boards, and one of the soldiers stood on the running boards as the car was going. And so she could see the light shining on the gun. Every time they'd stop us, they stopped us every few minutes. More of them would get on. And so after ever so long, we finally got to some sort of headquarters, and all of the VIPs that was in there telling me that we'd have to go back. And I was telling them I couldn't go back. I'd come to nurse the soldiers. So she goes on, and then they say, finally, we got to the chief nurse. She didn't even look up. Here she had these lines of nurses in here she was processing. And so she just kind of glanced up to the soldier who was standing guard over us and asked him who we were. He said, they say they are nurses. Of course, they had all doubts about it, because nobody believed it. She didn't even look toward us, and I started telling her just what the situation was. I had sent my application into the Red Cross, and I didn't hear from them. I said, I saw all these big signs in the newspapers that the boys were dying, and I came to nurse them, planned to stay. And she kind of looked up and she said, Miss Smith, you ought not to be here. You're supposed to be on the high seas. And I was just horrified with that. So to add a little, another kink in this plan. So the woman says that she ought to be on the high seas. Well, they had confused her with her sister, who was also a nurse, and her sister was supposed to be on the ship, and so they got the two mixed up. Anyway, she ended up staying. They let her stay, but she did not get to nurse the soldiers. She ended up doing sort of things outside of the nursing. It wasn't really what she wanted to do. And so they stayed there for about 3 months. And then they were told they were going to Camp Oglethorpe in Georgia. And so they were shipped off to Camp Oglethorpe, or Fort Oglethorpe in Georgia. So, so here's just a photo of some of the patients in the camp hospital in Camp Beauregard in 1918. So she only stays about a month or two at Fort Oglethorpe, and then she goes back to Mississippi to live with her family. After a short time there, she moves up. She gets a job as superintendent of the Tupelo Hospital up in Lee County, which is sort of northeastern Mississippi. You can see it shaded in yellow on that map. And she stays, she's superintendent, as I mentioned, at the Tupelo Hospital, where she stays for about a year. And that was not what she expected either. She expected sort of a more organized place. And the Tupelo Hospital turned out not to be organized at all. So she had to do a lot of the organizing of the nurses there and keeping, taking care of the patients. And so it really wasn't anything that she thought that she would be doing. And so she only stayed a year. She retired from the Tupelo Hospital, and she moved back to be with the family in Jefferson County, Mississippi. So fast forward a little bit, 1921, she moves. The family, her father and the whole family move to Little Rock in 1921. And you're probably asking yourself, why would she move to Little Rock? Well, her sister, who, I think this is the same one. Let me double check this. I'm not sure if it's the same one or not, but a sister of hers had married Homer Atkins, who would eventually be governor of Arkansas in the early 1940s. So her sister Estelle had married Homer Atkins. They were living in Little Rock. And so that's why the family ended up coming to Little Rock in 1921, is because the sister was already here. So she gets here in 1921, and she starts looking for a job as a nurse. And she first thinks that she could get a job with the city health department. Eventually, she gets a job with the state Board of Health. And so this is 1921. They had just gotten over the Spanish flu. A pandemic had just ended. But the State Board of Health was still it was in its infancy, because it had not been created until 1913. So it was only, what, 8 years old in 1921. And Charles Garrison, you see on your screen, was head of the State Board of Health. So she eventually gets a job at the State Board of Health. But before that, she went to the City Health Department, the Little Rock City Health Department. And this is what she has to say about that. Well, I knew that I wanted to be in public health nursing. I knew that. I first went to the City Health Department to seek employment. I didn't know whether they needed a nurse or not. And in the City Health Department, they did not have an organized nursing department that employed nurses. The health officer was not in, and I was just told to sit down and wait. There were some men in the office. They were employees, and they had their feet up on the desks. My sister was with me, and after a while, I wrote a little note and told her, let's get out. The health officer might come and might just by chance give me a job, and I couldn't work here. They left, and then from there, they went to the State Board of Health, and she meets Dr. Garrison, Dr. Charles Willis Garrison, and he gives her a job. And she, for that first time, for when she's working on that, she, in 1921, they had just received, the state had just received funds from the Shepherd Towner program, which had been passed in 1921. So in 1922, a few years after, they had just started receiving this money to help with mothers and babies, the health agencies sort of helping infants and mothers. And so she was hired as part of that program. And here's what she says about that. And I know I'm reading a lot about from her oral history, but it's such an interesting take, and it's her own words. So the Shepherd Towner Act was the beginning for health services and was the reason the state health department had some money. The health department had a traveling field unit. I think they had a pediatrician and 2 public health nurses for this field unit. One part of the public health nurse's duties was to go into a county that had not been served by the traveling unit to make the preliminary arrangements for the child conferences. Dr. Garrison knew this field work was coming up, and he thought they could use me. They had 2 public health nurses and needed another one, and he referred to me to Miss Lenny Beauchamp. And my slides are out of order, but I'm going to go back to that one slide there. So Lenny Beauchamp was another nurse who worked as part of this health unit, this mobile health unit. And Lenny Beauchamp was the director of public health nursing at the time. She wanted to employ well-prepared public health nurses. I had no formal preparation in public health nursing at the time. That was prior to the time, you see, that I had gone to teachers college. So she has education later on, more education. Miss Beauchamp and I went the next day to White County, to Searcy. We stayed up there about a month or 6 weeks, making an intensive survey of the community, getting acquainted with the facilities, the people, the physicians, all in preparation for the unit that would come on. Then I functioned on that unit with the physician, Dr. Margaret Koenig. So this was a mobile unit, and it was focused on keeping people well through medical supervision, preventive measures, and good health practices. So, you know, sort of the hallmarks of public health education. The mobile unit made possible the examination of children in isolated rural areas. Primarily, the service was for mothers and children and for public health education. Frequently, sick people would come to the conferences. For instance, when we worked in the Ozarks, people who had no access to a doctor would come when they knew a doctor would be there for some medical guidance. So So it's really an interesting, and it's a nice look into the early beginnings of public health education in Arkansas. So she worked with Lenny Beauchamp, who was a pioneer in nursing herself. And so she was with this unit for a while. And then here comes, so this is in around 1924 that she's working on this mobile unit. In 1927, I'm going to go back one slide if I can, the flood of 1927. And she happened to be, Mary Emma Smith happened to be up in Hardy during, in 1927. And so she gets marooned in Hardy because of the flooding. And she has, let's see if I can find it. She talks a little bit about, let's see. Yeah, here it is. So she talks about getting marooned in Hardy. And the question was, how did the state health department function in the 1927 flood crisis? And she says, well, it started for me at Hardy, where I was marooned because the Spring River rose 20 feet in a few hours. The rain continued for about 5 or 6 days. And Hardy is up in the northern part of the state, if you're not familiar with where it is. So it's sort of, I hope you can see my arrow on this, but it's sort of right up here, just to the east of Crowley's Ridge, or west of Crowley's Ridge, rather. So she says, rain continued for about 5 or 6 days before I could get to Little Rock. The flood was just getting worse and worse, and the problems were getting worse, and the people were being evacuated, and there were all the problems of communicable disease, typhoid fever, dysentery, all those diseases, always in tragedies, floods, and in tornadoes. There were many health problems, premature births, many accidents, and illness among children and older people. So there were many health problems as a result of the flood. I was told during the afternoon that a train was going to Forest City in a short time, and I was to go to Forest City, prepared to stay for several weeks, and because one of the emergency centers had been set up in Forest City. And she went there because she was asked to, she was asked what she was supposed to do in Forest City. And she said, and I asked what I was to do when I got there because I had no idea. And Dr. Garrison said that Dr. Charlie was there from the Rockefeller Foundation, and Dr. Charlie would know what to do. Well, it took a long, long time to get to Forest City because the water was all along the railroad on both sides and over the track in many places. When I arrived, a young man was at the train steps practically with arms extending, and he said, "You are Miss Smith." Yes. And so he said, "I'm so happy to see you. Both of us knew in general the public health problems to expect. He was an experienced health officer, and I was familiar with the State Board of Health's rules and regulations. So we sort of figured out the responsibilities together from that moment on, because actually we were in each other's hands, really. And he was a very well qualified health officer." So she ends up spending some time in Forest City during the 1927 flood. And she stays in Arkansas until 1931. She stays with the health department until 1931, when she moves to New York and accepts a job with the National Society for the Prevention of Blindness. And then later on, she would go to New Mexico, and then she would come back to Arkansas in 1936, go to Oklahoma for a couple of years, for a few years, and then come back to Arkansas. But I have this map on the screen because I want to read you just a little bit more. And I apologize if this is sort of seems like bedtime story, doesn't it, that I'm reading to you? But it's just so interesting, this oral history. So most of her work, most of Mary Emma Smith's work, focused up in the northern part of the state. And she talks a little bit about, in the oral history, she talks about the Shepherd Towner work and working with mothers and children, and then working with the midwives for midwife education. So this is what she said. She goes up into Madison County in the northwest part of the state. During my first trip to Huntsville, county seat of Madison County, this was the Shepherd Towner work. The primary purpose was to reduce the deaths the number of deaths of infants and mothers through safer maternity care than was being given by the untrained midwives at the time. Since births and deaths registration were so incomplete, the State Board of Health did not have the names of the people who had delivered infants in the county. Consequently, the midwives had to be located first, and that was part of my work. The state health officer would have written the physicians, if any, and the county officials about the program planned for that area, including the midwife survey prior to the arrival of the public health nurse. I recall that the farm agent and the county supervisor of schools were particularly helpful. Since I could not drive on the mountain roads, they would often drive the State Board of Health car if both of us had work to do in the same area. On one occasion, the county superintendent of schools had to visit schools in the St. Paul area. At that time, it was more than a day's journey in an old Ford over the mountains. He drove the car and we arrived after dark at Pettigrew, I believe, and the next day I journeyed on to St. Paul alone. He gave me the name of citizens in each community I had planned to visit who he thought would be glad to cooperate in the survey. The storekeeper at Pettigrew was a friend of his and lived with his family over the store. They had an extra room and I stayed there. When I reached St. Paul, I found a hotel known as Aunt Kate's that offered real luxury in those days in Madison County. It was like an oasis in a great desert to this traveling public health nurse. During my work there, people were cooperative in giving me the desired information after I had explained the purpose of the program. I visited the midwives in their homes. Often the person who told me about her would ask a friend or a neighbor to go to the home with me. This personal introduction was very helpful. The State Board of Health used form letters to communicate with the midwives after their names and addresses could be obtained and mailed to the state offices. Classes were arranged in several communities to teach the rules and regulations that govern the practice of midwifery in Arkansas, including personal cleanliness and cleanliness of the patient, importance of Medicare, safe procedures and unsafe procedures that the midwife was not allowed to perform under any circumstances. How to complete birth certificate, however. If this was too much for her to master, she was instructed in the vital information to obtain and to take to the registrar, who was required to complete the form and mail to the Bureau of Vital Statistics. So in addition to this education that she was giving to mothers and others in the community, the midwives, on the rules and regulations on how to deal with a birth overseen by a midwife, Mary Emma Smith was also instrumental in getting birth and death information for birth and death certificates, to be filed with the state health department. Because in those early years, again, just as the State Board of Health wasn't established until 1913, birth and death certificates weren't required until a year later in 1914. And still in the 1920s, they were really very spotty as to whether they would be filed. So that's why you have a number of people in the 1940s and 1950s doing delayed birth certificates because they weren't filed when they were born. And so Mary Emma Smith did a lot to get that, get good numbers as far as births and deaths on the record for the state health department. So just an interesting look into her work in St. Paul and the other, and that's just one example in her oral history. This is her oral history. You can see how thick it is. So just an interesting time capsule. So she, as I mentioned, Mary Emma Smith, in 1931, she goes to New York to work for the National Society for the Prevention of Blindness. And then in 1935, she goes to New Mexico to become the state director of the public health nursing. She comes back to Arkansas a year later in 1936 to work for the Crippled Children's Division in the Arkansas State Department of Public Welfare. And in that division, the CCD, the Crippled Children's Division. She was a real advocate for the children in that division. There's one story that she mentions in her oral history about advocating for this one child who needed, who had a lot of health problems and needed surgeries. And in the midst of it, she was working with the medical directory at a hospital or medical director at a hospital. And while the child was in the hospital, the medical director dies, and no one was really in charge of the hospital. So she stepped up and just to oversee, see that the needs of the child were taken care of, and then the child got the surgery that he needed. And so she was an advocate all of her life, but particularly in the Crippled Children's Division, I think she did a really extraordinary job. So she stays with the CCD in the Department of Public Welfare for a couple of years. Then she goes to Oklahoma, the State Department of Public Health, to do some work out there. People who knew her in Arkansas during her time, they kept trying to convince her to come back to Arkansas. Finally, in 1942, she does come back to Arkansas, and as part of the CCD, the Crippled Children's Division, again, the chief orthopedic nursing consultant. So she does come back. She stays in Arkansas this time for about 5 years. Then she goes to Columbia University and goes to Teachers College and completes her degree in public health nursing in 1949. She comes back to Arkansas to the health department as generalized public health consultant, and she stays with the health department this time for 10 years until she retires in 1959. Now, as you can tell, she was a very active person in the nursing field. But going back a little bit, during her time in in Arkansas during World War II, in addition to her regular job, she was the representative from the Arkansas State Nurses Association. And I'm going to talk about the State Nurses Association here in a minute, but she was a representative from the State Nurses Association to the draft board. She was the state chairperson for the Manpower Commission for procurement of nurses for military service. And she was appointed by FDR, President Roosevelt, as chairman of the procurement and assignment of nursing activities for the Bureau of Maternal and Child Hygiene. So she was very well respected in the nursing community. Now, the Arkansas State Nurses Association, Mary Emma Smith was very active in that. She served as president during her time in Arkansas as part of that association. The State Nurses Association went back all the way to 1912, and Mary Emma Smith, when she first got to Little Rock in 1921, and she first got her job around 1923, 1924, she was very active in the Arkansas State Nurses Association. Excuse me. And she advocated, as we know, for public health. She advocated for licensing for the nursing profession in Arkansas. She was very instrumental in getting licensing regulations passed in the Arkansas legislature. And she was also one of the first people to publicly support the creation of the School of Nursing at the University of Arkansas Medical Center. At that time, it was still a part of the U of A Fayetteville campus. The Department of Medicine was part of the university, of course. That was the School of Medicine, and that had been, in existence since as part of an official part of the U of A, 1911, 1912. But the School of Nursing was founded in 1953. Julia Miller, who you see on your screen, she was the first dean of the school. But Mary Emma Smith was very instrumental in getting the School of Nursing up and running at the medical school. And so without her advocacy for that, I think that, it's hard to say if the school would have been delayed, but I think having someone with the high profile such as Mary Emma Smith had, I think it really did a lot to put the School of Nursing on a path to creation, and then to obviously keep it, get it funded and things like that. Her family, there's a scholarship for Mary Emma Smith with the College of Nursing now. And Mary Emma Smith actually received the State Nurses Association Hall of Fame Award and was an honorary life member of the association. She lived to be 105, 106, maybe, I believe. She died in 1997. Remember, she was born in 1891. On her 105th birthday, rather, she received a citation from the National Board of the American Red Cross, honoring her years of service and dedication to the nursing profession. And again, I want to thank Betty Hart for this information about Mary Emma Smith. But she was not only just instrumental and significant in the nursing fields, she was also just a community service minded person. She was, as I mentioned, she was one of the founding regent of the Prudence Hall chapter of the Daughters of the American Revolution. And she received
No. 1962, there was a group of ladies who decided to meet with the state regent and talk about organizing a chapter here.
Okay.
The first meeting then was held in 1963 at the Lehman Library, and she was organizing regent.
Okay.
Ironically, Lehman Library is one of our favorite meeting places till today.
Lehman Library is a good library.
Miriam and I had met as we were both members of Parkville Baptist Church. She noticed a query of mine in the Arkansas Family Historian and asked if I was interested in VAR membership. She invited Wanda McDonald, Peg Beasley, and I to her home on West K and explained the process to join the chapter. I had been chasing genealogy for a while already and had what I would need to complete the application. Note that the process at that time was that I complete my own application, take it to the registrar for her to approve and sign, then take it to the regent and sponsors for their signature and mail it myself. One day we made a trip to Malvern as she knew there was a Hart cemetery there and knew some of the descendants of that family. Indeed, there were distant relatives of my husband's. And it was an interesting trip. She stayed active in our chapter until she. We are working to add information to her entry at the Women's Military Memorial. Her brother saw that she was entered in the memorial earlier. Also, this month of September in 2021, Prudence Hall chapter placed DAR emblem on her tombstone at Roseland. This was near the 130th anniversary of her birth in 1991.
I was honored to be at that ceremony, and it was out at Roselawn Cemetery. And Mary Emma Smith, she was an amazing woman, and she deserves all the recognition, a lot of recognition for the public health, the state of public health that we have now in Arkansas with the State Board of Health and all that's associated with it. She really did really miraculous things in Arkansas. And I'm going to stop the program, the PowerPoint. And if anyone has any questions or anything, please feel free to, you can use the chat box, or if you can unmute yourself if you'd like, if you want to just unmute and ask a question, or if you have any, additional information about Mary Emma Smith, we'd all love to hear about it. And I want to thank again Betty Harp and Teresa Clark, who's on here, and Elizabeth Hill. And there's probably some other DAR folks that I'm not aware of or I'm not seeing, just for their help, their work in recognizing Mary Emma Smith. She is truly worthy. That was the word I was trying to look for. Worthy of being recognized for all of her contributions, because like I said, she did so much for the nursing field and public health fields in Arkansas. We have any questions or comments? I will remind you that this program was recorded and it will be uploaded to the YouTube channel. Probably it takes about a week or so to get up on the YouTube channel, but it will be available, and you can share the recording with people who might be interested in watching it if they weren't able to be here tonight.
Tim, this is Betty Harp.
Yeah.
Let me just say that part of Mary Emma's work, wherever she was not only because of her reputation and her stature in the field, but she was persistent. She got behind something. She was going to see it through.
Mm-hmm. I don't think she would not have been able to accomplish as much as she accomplished without being persistent. She was, yes.
You go ahead. I thought you were through.
I am through.
Okay. This is Elizabeth Hill, and
yeah.
And this has been so wonderful to me. I have not read her all that inch and a half of her autobiography that she gave, but this is just kind of making me salivate as a women's historian, because when I did the history of the home demonstration clubs, I learned about the Shepherd Towner, and then when the women did so much work during World War I with the children and everything. So it's just thrilling to me. And thank you so much for doing this for us.
Oh, well, you're welcome. And I, thank you and Betty and others with the DAR for, I'd in my research, I had come across Mary Emma Smith, but I really had no idea of her significance and what all she had accomplished here in Arkansas. So thank y'all for introducing me to Mary Emma Smith. And I do want to mention the oral histories. These were done through the oral history program at UCA in the early 1970s. And they did a lot with the presidents of the Arkansas State Nurses Association. And they're not all this thick, but what I'd like to do, and I'll contact the folks at UCA, because I'd really like to make these more available to people. We have a print copy of it, the print copy up at UCA, but I think if we can digitize these and get these on the internet, I think it would be such a testament to their legacy and really bring not only what Mary Emma Smith did, but the other women who were involved in the Arkansas State Nurses Association. I think it would be a really wonderful resource for historians and others who are just interested in the history of the nursing association or the nursing field in Arkansas. So I'm going to work on that and contact the folks up at UCA and see if we can do that.
This is Elizabeth again, and I agree with you. I think it's really important, and it's something that needs to be done, and I appreciate you're doing that. And I shouldn't take much credit. It was Betty and Teresa who did all of the work. I happened to get to be there for when we recognized her at the cemetery. And
I don't know Teresa very well. I do know Betty fairly well, and talk about persistent. Betty's very persistent as well. I'm glad to know Betty. Betty's a great friend of mine. So, Michael, I saw that you had unmuted yourself. Do you have a question?
Yeah, I was trying to stretch my memory here back on the Towner business with, was it Frances Sage Bradley who came in? Good, I got the name right.
Yes. Mm-hmm.
And she left the state because the political climate changed and became international, a very famous person, and the photographs in all of her papers ended up at Emory University. But I'm just wondering about the political connections in her life. Can you say anything to those?
I can't really, you know, obviously she had some political connection with her brother-in-law being Homer Adkins.
Well, it's a good thing I was muted when that came off, because I let out a hysterical scream.
So, yeah, I think I have not really delved into the political connections, but, you know, it's obvious that she had some political connections with her brother-in-law being Homer Adkins. So it'd be interesting if anyone has some extra time to delve into that. I'd encourage you to do that.
Well, he's not one of our progressives. Let's put it that way.
No, he is not, unfortunately. But you know, let's hope. I don't know much about Mary Emma's sister Estelle, but I hope she was more progressive than her husband.
It happens sometimes.
It does happen sometimes. Well, we're getting close to 8 o'clock. If anyone else has any questions, please, or comments, please, you could unmute yourself, or if you're hesitant about voicing it, please feel free to use the chat feature on Zoom. And if not, if there aren't any additional questions or comments, I'll close down for tonight. But I do want to remind you that this is recorded, and I'll send out an email when the recording has been uploaded. So I'll include the link in it, so you'll be able to go to it. And if you have any questions, my email, I will type my email in the chat box so you can see it. And if you have any questions, please feel free to send me an email and or comment, and I'll be glad to get back with you. And again, thank you all for being here tonight. I really appreciate it. Hope you'll join us next month when Dr. Bill Gurley will be here to talk about Dr. Henry Dye. Thank you all. Y'all enjoy this nice weather, and I will see you next month. Take care.